You know, I found myself during this last maybe week or so in this very bizarre state of being. It's almost like a weird duality, superposition of states, if you want to call it, where I have zero satisfaction or zero joy in me that Joe Biden has won this race. By the same token, I have no satisfaction that Donald Trump lost. And that's not entirely true. I have a little satisfaction that Trump lost. Both of those things kind of exist side by side. If Joe Biden would have lost this race, the same factors would have been true. I would have had a certain satisfaction that Joe Biden lost this race, even though there would have been no joy that Donald Trump won it. There are certain aspects of Trump losing that I find satisfying. The main one, honestly, more than probably anything else, has to be the response to COVID. Trump knew what it was. He knew how bad it was. He knew how infectious it was. And yet, incompetence, radical, criminal, I would even argue impeachable incompetence. Hundreds of thousands of people dying. You had China, where this disease started, getting it under control. Competence, intellect, skill, mastery of the political space in order to do that particular task of solving that particular issue. But in the United States, the exceptional country, incompetence. It got so bad in the United States that you had states and local police forces being put by the governor to guard supplies because the federal government was stealing those supplies. That's how bad it was. That's how lack of supplies. Instead of the president marshaling the forces of this country in order to ensure that those nurses had their gear, that they had their equipment, that they had their protective equipment, and then marshal the resources to ensure that the testing kits were in place. We didn't do that. We didn't do that. Other countries around the world seem to be far, far more capable. And even now, the president of the United States, for the next few months anyway, shuffles his way into a situation of people dying with him not seeming to care. It is utterly and entirely bizarre. The president is tweeting one tweet after the next, screaming that he's being cheated, screaming that the public is, or he's being ripped away, the president is being pulled away from him. And yet, all of these people are dying. How do you have it both ways? Yes, the president is being stolen from me. That's what he's screaming. He's on Twitter, bashing his fingers in. But the actual job of the presidency, governance, to ensure that all of these people aren't dying and to stem the tide of this disease that's ravishing the nation. It's almost as if Donald Trump, sitting in his bunker, is making this thing of the people didn't put me back in office, so I'm going to let you be engulfed by the flames of this disease. That's what it appears. And yet, his ego doesn't allow him to admit that he just utterly and entirely, irreparably failed. And because of such, over 240,000 people no longer exist in this country. And by the way, at this point, 11 million, at the very least, will be dealing with symptoms that extend beyond the virus itself. The Trump administration right now is still putting out ludicrous pronouncements that will get people infected and will most likely get people killed. And on Fox News, his press secretary, still towing the line for failed administration, is still putting out ridiculous diatribes about how they are preparing for a second administration. They are not. And on top of that, making the point about the pronouncements for the health of people during Thanksgiving and the Christmas holidays, where all of these family members are going to be coming together, that they are Orwellian. Now, either this will be, from henceforth, a textbook definition, fucking picture in a dictionary, with her face on it, of the meaning of Orwellian. With the word being used, how can I say it? That sounds weird. It's like the word it's a double entendre, but the word is being used as almost like a parody of itself, representing itself. It's so bizarre. I'm going to show you this. By the way, I'm going to show you. It's utterly horrendous take. But this is what these guys have been pushing. And fact is, Fox News has, for the most part, been pushing this stuff too. But the host, in this case, at the very least, seemed to be taken aback. I mean, what they seemed to ask her seemed to kind of, I guess, position in a way of making the point that, hey, this seems to be a potentially dangerous period, seeing as we're in the winter and this Thanksgiving and all of these people are going to be at family gatherings. But she takes it in a completely different direction. Just to be clear, 11.4 million people have been affected, 248,462 deaths as of the reading of this particular New York Times piece. And she is still making this argument that the precautions and taking these precautions are Orwellian. McEnany. I'm trying to find the thing. I'm sorry. There we are. Kayleigh McEnany, the picture, poster child for the definition of Orwellian. Welcome to the Soapbox. My name is Jamarl Thomas. This is the Progressive Soapbox. Guys, if you dig this content, please like, share, and subscribe. You can always support this content through PayPal or Patreon. This content is brought to you by you, and I appreciate you the opportunity for allowing me to do so. So before I show you her video, I'm going to preface this with the numbers. Just a brief rundown on what we're experiencing right now with COVID-19 in this country, as the numbers spike beyond anything that we've seen in the past. Meaning even beyond that quote-unquote first wave. I would argue these aren't waves. This is one continuous horror show. This is New York Times. This is their reporting on it. Cases, 11.4 million. Deaths, 248,462. At least 1,583 new coronavirus deaths and 159,508 new cases were reported in the United States as of November 17th. We're up to the point of having over 150,000 a day. That's one point. And deaths are surging to the point of 200,000. At this point, it's 1,500, but they've been estimated to go to 2,000. As of Wednesday morning, more than 11,439,000 people in the United States have been infected with the coronavirus, and at least 248,000 have died, according to the New York Times database. Now, these are the states where the cases are going higher and staying high. Yes, that's a lot of them, the majority of them. Here are the ones where the cases are lower but going up. Vermont and Maine, just two. Lower and staying low. 3 states. Well, I'm sorry, 1 state, Hawaii. Understand what's being said. The entirety of your country, with the exception of Hawaii, has cases that are going up or dramatically going up. Here are the states where the deaths are increasing. Pretty much all of them. These states had the highest growth in newly reported deaths over the last 14 days. Now, here's the other amazing stat. At one point, we hit 1 million. I think it took 14 days. And then within a short period of time, it took a week. And then it took 5 days. Like, the number is tumbling head over heels. There is no control in this. It's almost like a snowball effect at this point. And this is not just 1 or 2 states. This is basically the entirety of the country. The areas that were thought to be safe zones are no longer safe zones. As people migrate from this place to that place, sometimes people drive, people go out to the stores now, people feel more free, or people get sick of being in the house. And yeah, you get a half-ass effect that didn't necessarily give you the bang for your buck in order to stop the virus in its tracks. You had a sluggish administration. You had a sluggish uptick in people wearing masks. You had a sluggish push for people to wear masks. And now you have this kind of weird scenario where this thing has just taken off. And when people were trying to pull the reins off, meaning, okay, let's try to open it up, now they're trying to re-ravel. How far does that raveling go? Trump is not going to shut down the economy, and I have a hard time believing that Joe Biden would even do such. And so we are in for a very bad winter. And again, on some level, we did it to ourselves. This is the curve. Cases. The curve and deaths is on its way up. Certain states, I believe it was Utah, Texas, these states are at the point of basically rationing care because they don't necessarily have all of the tools or the staff necessary to be able to handle the influx. Keep in mind, the main issue that we were dealing with, or that the reason why they had those shutdown measures and they shut down the companies and the jobs and whatnot, was because they didn't necessarily want it to spread beyond the point where the hospitals could deal with. If you had a small slope where people are going into the hospitals, well, the hospital can still function while dealing with that. But if you get to the point where the hospitals are overflowing, then what about people with cancer or other illnesses that need to get diagnosed or need to get treated or other emergencies? Well, that hospital gets filled up to the point where it can't, and the hospitals around it can't compensate with the number of people to go. It's kind of like a parking lot. The parking lot doesn't necessarily have enough if the restaurant is entirely full, but typically the restaurant is not entirely full. So you kind of take that, you take it as a give and take. But in this very specific case, well, that take is out the window because these hospitals are getting full. And it doesn't seem to be abating anytime soon. And the president and the federal government, who's supposed to be getting a handle on it, doesn't even seem to be focusing on this at this point. The guy that Trump has in, Atlas, is not an epidemiologist. He's not even a disease specialist. That's the guy that Trump is listening to on his policy. Basically, let the weak die off. Go look at his Twitter feed. This is his policies. So Trump can get a clear conscience, hear somebody that doesn't know what the fuck they're talking about, tell him that he doesn't have to worry about it, there would be herd immunity and all this other stuff, and Trump can go tweeting away on why he should be president despite the fact that people are dying like flies under his watch. This is what Trump's White House is pushing at this point. Orwellian. If there is a video dictionary with the term Orwellian, this would be what was in it.
But we know all across the country, Kayleigh, cases are spiking, unfortunately. And this is the week before Thanksgiving when families are going to be together. And there are a number of governors who are suggesting, look, you don't need to be in a big group, particularly if people are outside your bubble. What do you think of these suggestions and guidelines some of the governors have given in advance of this, because it is a super contagious disease?
Yeah, I think a lot of the guidelines you're seeing are Orwellian. Let me start by saying the CDC has put out considerations as we prepare to go about Thanksgiving, about socially distancing, wearing masks, doing what you can. There's a whole list, a page of very good considerations. And in that, they say, we're not recommending a certain number of people, but we are giving considerations that you should put in place. And I think that's the American way. The American people know how to protect their health. We've dealt with COVID for many months, but it's Orwellian in a place like Oregon to say, if you gather in numbers more than 6, we might come to your house and arrest you. And you.
Now, she used the term Orwellian twice. Either she does not know what that term means, which is possible, I suppose. She's Trump's press secretary. Or she is using the term Orwellian to cover up the fact that what she is saying is Orwellian. It's reverse psychology, all on Fox News. It's Orwellian to say this is Orwellian. How weird is that? Fact of the matter is, I promise you, Oregon does not want to put restrictions on its citizens. I promise you that these other states do not want to put restrictions on its citizens. And more on top of that, the reason why they were trying to open up the economy, because they're sick of this. All of these people are tired of it. By the same token, the majority of the public agrees. That's the part. The majority of the public, even though it is sick of the lockdowns, when they see these numbers go up, they want restrictions. I mean, it's like the government, the country backs it. The country, in fact, it goes further than that. I don't believe in an enforced universal mask ban across the country. I think that gets weird on a federal level. By the same token, do I think people should wear them? Hell yeah. Do I think states should implement them? Yes. The public, when asked, at least by polling, it was like 59% said, yeah, there should be a national mask ban, national mask, where they enforce it. I think that is, look, I suppose is there a difference between having states make the choice for the mask and then, versus the federal government? Maybe. I mean, the states might have different contours. You might have some states that may not get hit as bad. You have some states that may, as it recedes faster because of the actions that the state is taking. I don't know. I guess I'm making the point that the public itself was more on board with that. I am definitely on board for wearing masks if you're in a store. Totally. If you are in public. Totally. Sitting in your car? No. Sitting on a park bench? No. This is why I'm against the federal mask ban. I think it gets a little weird sometimes in the way it may get implemented. But either way, besides the point, I'm just making the very basic point that the public is on board for this. And part of the reason that Trump, I would argue, lost this was because of that. The public wanted him to take more assertive action on the issue of COVID. Trump did not do that. He pushed against the public on that very specific point. And, look at the results. Orwellian. I'm blown away by that. Look, the reason that they're doing this is because what they recognize is that it spreads. And at this point, the spread has gotten out of control. And because it's gotten out of control, more focus and more attention has been given to this idea of let's not have this propagate itself through super spreader events in the various families. This person goes with their families. I said there are 10, 15 people there. One person gets it. Several people there end up getting infected. Those people go out to their various communities, some with elderly, some at the various church services, some might be going to the store. But these people ends up spreading this around, even if it's a small percentage of people. If you're talking about large numbers of gatherings, that percentage gets magnified and compounded as those people start interacting with other groups. Yeah, it's problematic. During the wars, they may say black out your windows. They say black out your windows because if there's a bombing raid, they don't want people to be able to see what's on the ground. They used to put people in prison if they didn't do that. Like, there's certain things that are communal that go among all of us, where you are not an Allen unto yourself, and that the things that you do are not specific unto you, especially if it's somehow going to leap off of you and jump into me because you didn't necessarily take the most basic of precautions. I don't like the lockdown. By the same token, I have multiple people in my family, including myself, with all sorts of comorbidities. So from my perspective, it is well within my political interests to say, yes, I am okay with this idea of, I guess, what do you call it, stricter guidelines? I mean, those guidelines are basically bars shutting down, restaurants closing at an earlier time, takeout still being open. Basically what's been in place for the last several months. Okay, I can live with what's in place for the last several months. This, however, is appalling. You should be ashamed of yourself. Yeah, open your eyes when I'm talking to you. Open your eyes when I'm talking to you. Shame on you. Shame on you. How do you sleep at night? I imagine the cash that she gets makes it that much easier to rest. Like, share, and subscribe.